Good morning, guys. Tony Maritato here, licensed physical therapist, and in today's video, I want to talk about the difference between a recumbent bike and an upright bike, specifically related to the hip, knee, and ankle when we're working on range of motion through the knee. Now, whether you've had an ACL reconstruction, a total knee replacement, arthroscopic debridement, meniscus repair, there's lots of procedures that are gonna typically use one of these two bikes to help you regain range of motion, improve circulation, get the fluid out of the lower extremity back into the system. But the range of motion is what we're gonna focus on. I've got a little goniometer here just to give us some rough numbers, but typically when I'm sitting on a recumbent bike, patients like the recumbent bike because they like the backrest, they like to be able to recline and sit back into it. It gives them a sense of at least abdominal trunk bracing. When I'm setting up on a bike like this, the normal setup position would be my knees a little bit wider than my ankle, my ball of my foot is on the pedal, and as I'm going through a revolution, I want the seat to be as far back as I can while comfortably still reaching the far end of the pedal revolution. From a hip perspective, and this is really the thing with a recumbent bike, it does require quite a bit of hip flexion. So if I open up my goniometer, I line up roughly between my body and my thigh, I get a quick measurement. I'm sitting at about 110 degrees of hip flexion. For the knee, right here, I'm sitting at about 110 degrees of knee flexion. Now, I can obviously play around with this a little bit. I can try and move the seat back a couple inches. It now becomes harder for me to reach the far end of the pedal. As my range of motion improves, I can move the seat forward more. It's gonna give me more knee flexion. So to give you some perspective, we went from 110. Here we're looking at about 132. So the recumbent bike has some advantages in that it's usually a bigger seat, back support, a little more comfortable, but it requires a lot of hip, knee range of motion. Now, on the upright bike, so if I start with the seat nice and high, just like on the recumbent bike, we slide the seat back initially and then move forward. On the upright bike, I raise the seat so that when I'm coming in, what I want to do is I want to have the seat absolutely as high as it can so that when I point my ankle, I plantar flex my ankle, I can still reach the pedal at the bottom of the revolution. But if you notice at the top, I have much less hip flexion going on. So now the angle of hip flexion is sitting at about 75, where over there we were closer to 110. The knee flexion, let's see what we've got. And these are rough estimate, guys. The knee flexion is only about 60. And so this is where on an upright bike, I can get a little bit more motion through the bike. Not necessarily motion through the joints. The joints are actually moving less, but it's allowing me to facilitate some rhythmic stabilization, rhythmic movement through the bike. And then as I improve, this is where we come in and we can lower the seat. We come back on. Now I'm looking at something closer to about 90 degrees at the hip relative to the body, but the knee flexion can be as much as, let's see where we are. That's about 115 where it is right now. And I could lower the seat even more, and I can pedal even more, and I can work on this a little more. So there's absolute advantages in terms of positioning and comfort relative to the trunk, the low back, the body on the recumbent bike. But in terms of versatility for the motion at the hip, ankle, and knee, I really prefer the upright bike for anybody who's capable of doing it. Now the drawbacks, right? It's harder to get on and off. I have to be able to kind of step over. If you're doing this and you're post-surgical, usually the best way to do it is if my left knee was the knee that was replaced, I'm going to use that as my support leg while I bring the right one over, because this, getting on and off the bike, is really the more kind of dangerous position that we need to be aware of. So you want to do it as safely as possible. Now, if you don't feel like you can support yourself on the surgical side, you come over on the non-surgical side. The challenge is a lot of patients can't get that over the hump in the middle. That's why we prefer often the recumbent bike without the center console. So bottom line is, there is no right or wrong. You choose what you have access to, what feels the most comfortable for you. The most important thing is you just get moving. So in the next video, I'll talk about some other pieces of equipment that people commonly use after a knee replacement. But if you have a favorite, let me know down in the comments below, and I'll catch you on the next